So I'm now gonna perform an inline aerosol. So first and foremost, make sure we check the patient's chart. Make sure we have the medication with us. Take note also if there are any changes of the order, such as the frequency. And then once we're all set and ready to go, wash or sanitize our hands. Wear appropriate PPE such as gloves, masks, and if possible, there should be a goggles. Introduce ourselves, greet the patient despite most of them, especially intubated patients, to be unconscious. Talk to the relatives if they're present. Let them explain and understand what we're trying to do. And after that, double check the ID band for confirmatory purposes. Assess the patient, listen to the breath sounds. Take note also the other vital signs such as the SpO2, heart rate, and also once we sense the secretions, we can try to suction it first before doing the treatment, and also make sure we take note the ET level. Once we're all set and ready, we're gonna start with the treatment. So in here we have this T adapter for the nebulization treatment. Some hospitals would like this to be built in already with the tubing. So with this, if we want to put it on the circuit, make sure we hook it up on the inspiratory side of the tubing. So if this is this inspiratory line, make sure we put it over in here on front, and then make sure it's being secured, then it's not loosened up. And then this tubing should be inserted it on this side, and there's a note on it for the nebulization. And then if this is the patient's ET tube, all we have to do is position the adapter on an upright position. We should avoid from having it sideways or even downward, so that we can make sure that there is adequate mist that we're about to give to the patient. So assuming we're all done or set ready, so once we have the medication in place on the medication cup, all we have to do is press this button and then it will start it up. So another thing to note is that we can also try to check if there is mist going in, and there's also a hissing sound. And then another is that once we give this treatment, we should also take note that it might affect slightly changes with the parameters of the patient, such as the tidal volume, and also take note also if there are any alarms that might trigger, such as increase in pressure. So we should also take note of that. So for another thing is another important detail that I would like to mention is if patients on HME. So if this blue thing is the HME, assuming when giving treatment, all we have to do is remove this and replace it with the nebulization T adapter. The reason why we remove the HME is because we will prevent the medication from being stick on the HME or the filter. Because if we have the HME in place while giving the treatment, this would lead the medication to stick, and then it will avoid having benefit to the patient. And then once we're all done, all we have to do is press. So once we're done giving treatment, press it up and then turn it off like that. And then also another important detail after giving treatment is make sure we listen to the breath sounds post-assessment. Make sure we try to listen on the lung sounds of the patient. If there's secretions, loosen up, so that it means it has any benefit from the breathing treatment. Make sure we suction after, so that way we can clear the patient's airway. Take note also the changes of their SpO2 level if it improves after giving treatment and suctioning. Take note also of the heart rate, especially for any changes, and then side effects. And then once we're all done, remove the PPE. Once we're all done with the suctioning and the breathing treatment, wash our hands, chart everything what we did to the patient, and communicate with the healthcare staff.